Question 1. A 68-year-old client with a history of chronic heart failure presents with acute dyspnea, pink frothy sputum, and crackles throughout lung fields. The nurse prioritizes which intervention? A. Administer IV furosemide. B. Place the client in high Fowler's position. C. Administer oxygen via non-rebreather mask. Or D. Initiate IV fluids at 100 milliliters per hour. Answer C. Administer oxygen via non-rebreather mask. Rationale: airway and oxygenation are priority. Acute pulmonary edema requires immediate oxygen support before diuresis or positioning. Question 2. A post-operative client develops sudden chest pain, tachycardia, and oxygen saturation of 88%. Which action should the nurse take first? A. Notify the provider. B. Administer oxygen. C. Prepare for CT angiography. Or D. Elevate the legs. Answer B. Administer oxygen. Rationale: suspected pulmonary embolism, oxygenation first, ABCs, before diagnostics or provider notification. Question 3. A client with diabetic ketoacidosis, DKA, has a blood glucose of 520 milligrams per deciliter and potassium level of 3.1 milliequivalents per liter. Which order should the nurse question? A. Start insulin infusion. B. Administer potassium replacement. C. Initiate IV normal saline. Or D. Monitor cardiac rhythm. Answer A. Start insulin infusion. Rationale: hypokalemia must be corrected before insulin. Insulin will further drop potassium, risk of fatal arrhythmias. Question 4. A client receiving a blood transfusion develops chills, fever, and low back pain. What is the nurse's priority action? A. Slow the transfusion rate. B. Stop the transfusion. C. Administer antipyretics. Or D. Notify the provider. Answer B. Stop the transfusion. Rationale: suspected hemolytic reaction, immediate discontinuation prevents further complications. Question 5. A client with increased intracranial pressure, ICP, is being repositioned. Which position is most appropriate? A. Supine, flat. B. Trendelenburg. C. Head of bed elevated 30 degrees. Or D. Side lying with knees flexed. Answer C. Head of bed elevated 30 degrees. Rationale: promotes venous drainage and reduces ICP without compromising cerebral perfusion. Question 6. A nurse is caring for a client with SIADH. Which finding requires immediate intervention? A. Urine specific gravity of 1.030. B. Sodium level of 118 milliequivalents per liter. C. Decreased urine output. D. Weight gain of 1 kilogram. Answer B. Sodium level of 118 milliequivalents per liter. Rationale: severe hyponatremia, risk of seizures, coma, priority emergency. Question 7. A client with COPD becomes increasingly restless and confused. ABG results show PaCO2 of 60 millimeters mercury. What is the nurse's interpretation? A. Respiratory alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Metabolic alkalosis. Answer C. Respiratory acidosis. Rationale: elevated CO2 equals hypoventilation. Respiratory acidosis causes confusion or restlessness. Question 8. A client with hyperkalemia, K plus equals 6.5 milliequivalents per liter, is at risk for which complication? A. Seizures. B. Cardiac dysrhythmias. C. Respiratory depression. D. Hypotension. Answer B. Cardiac dysrhythmias. Rationale: hyperkalemia directly affects cardiac conduction, life-threatening arrhythmias. Question 9. A client post-thyroidectomy develops stridor. What is the nurse's first action? A. Check calcium levels. B. Administer analgesics. C. Prepare for emergency airway management. D. Place client in semi-Fowlers. Answer C. Prepare for emergency airway management. Rationale: stridor equals airway obstruction, immediate life-threatening emergency. Question 10. A client with sepsis has BP 82/48 millimeters mercury, HR 120 beats per minute, and lactate 4 millimoles per liter. What is the priority intervention? A. Administer IV antibiotics. B. Start vasopressors. C. Rapid IV fluid resuscitation. D. Obtain blood cultures. Answer C. Rapid IV fluid resuscitation. Rationale: septic shock. First line is aggressive fluids before vasopressors or antibiotics. Question 11. The nurse receives report on 4 clients. Which client should be assessed first? A. Client with pneumonia and temperature of 38.3 degrees Celsius. B. Client with heart failure and 2+ pitting edema. C. Client with chest pain rated 8 out of 10 and diaphoresis. D. Client with diabetes and blood glucose of 250 milligrams per deciliter. Answer C. Client with chest pain rated 8 out of 10 and diaphoresis. Rationale: suspected acute coronary syndrome, immediate life threat. Question 12. A client with a spinal cord injury at T6 develops severe hypertension, bradycardia, and headache. What is the priority action? A. Administer antihypertensives. B. Lower the head of the bed. C. Check for bladder distension. D. Notify the provider. Answer C. Check for bladder distension. Rationale: autonomic dysreflexia. Remove trigger first, often bladder. Question 13. Which task is appropriate for the nurse to delegate to an unlicensed assistive personnel? A. Assess pain in a post-operative client. B. Ambulate a stable post-operative client. C. Teach insulin administration. D. Evaluate wound healing. Answer B. Ambulate a stable post-operative client. Rationale: stable routine tasks can be delegated. Assessment and teaching cannot. Question 14. A client with Addison's disease is experiencing weakness, hypotension, and hyperkalemia. Which medication should the nurse expect to administer? A. Insulin. B. Hydrocortisone. C. Levothyroxine. D. Furosemide. Answer B. Hydrocortisone. Rationale: Addisonian crisis. Cortisol replacement is life-saving. Question 15. A nurse is caring for a client receiving heparin infusion. Which lab value requires immediate action? A. APTT 65 seconds. B. Platelets 90,000 per millimeter cubed. C. Hemoglobin 13 grams per deciliter. D. INR 1.0. Answer B. platelets 90,000 per millimeter cubed. Rationale: suspected HIT, heparin-induced thrombocytopenia, stop heparin immediately. Question 16. A client with hypocalcemia exhibits which priority symptom? A. Constipation. B. Positive Chvostek sign. C. Muscle weakness. D. Hypotension. Answer: B. Positive Chvostek sign. Rationale: neuromuscular excitability, risk for tetany and airway compromise. Question 17. A nurse is caring for a client with acute pancreatitis. Which finding requires immediate intervention? A. Epigastric pain radiating to the back. B. Serum amylase elevated. C. Calcium level of 7.5 milligrams per deciliter. D. Nausea and vomiting. Answer: C. Calcium level of 7.5 milligrams per deciliter. Rationale: hypocalcemia, risk for tetany and cardiac issues, priority. Question 18. A client receiving morphine becomes difficult to arouse with a respiratory rate of 8 per minute. What is the priority action? A. Notify the provider. B. Administer naloxone. C. Apply oxygen. D. Stimulate the client. Answer: B. Administer naloxone. Rationale: opioid overdose, antidote first to reverse respiratory depression. Question 19. A nurse is assessing a client with fluid volume overload. Which finding is most concerning? A. Weight gain of 1 kilogram in 2 days. B. Crackles in lung bases. C. Bounding pulse. D. Neck vein distension. Answer: B. Crackles in lung bases. Rationale: indicates pulmonary edema, airway compromise risk. Question 20. A client with a new tracheostomy suddenly becomes restless with decreased oxygen saturation. What is the nurse's first action? A. Call the provider. B. Suction the airway. C. Check for tube obstruction. D. Increase oxygen flow. Answer: C. Check for tube obstruction. Rationale: airway first, always assess before intervening.
Question 21. Select all that apply. A nurse is caring for a client with hyperkalemia. Which interventions are appropriate? A. Administer calcium gluconate. B. Administer insulin with dextrose. C. Encourage potassium-rich foods. D. Administer sodium polystyrene sulfonate. E. Monitor cardiac rhythm. Answer: A, B, D, E. Administer calcium gluconate. Administer insulin with dextrose. Administer sodium polystyrene sulfonate. Monitor cardiac rhythm. Rationale: stabilize heart, shift potassium into cells, remove potassium, and monitor ECG. Avoid potassium intake. Question 22. Which client is appropriate for assignment to a float nurse from the medical surgical unit to the ICU? A. Client requiring titration of vasopressors. B. Client on mechanical ventilation. C. Stable client awaiting transfer. D. Client with unstable hemodynamics. Answer: C. Stable client awaiting transfer. Rationale: float nurses handle stable patients. ICU level care requires specialized training. Question 23. Select all that apply. A client with Cushing's syndrome is assessed. Which findings should the nurse expect? A. Moon face. B. Weight loss. C. Hyperglycemia. D. Thin extremities. E. Hypotension. Answer: A, C, D. Moon face, hyperglycemia, thin extremities. Rationale: Cushing's equals excess cortisol, leading to central obesity, high glucose, muscle wasting. Question 24. A nurse is caring for 4 clients. Which task should be delegated to an experienced LPN? A. Initial assessment of a new admission. B. Administer oral medications to stable clients. C. Develop a care plan. D. Provide discharge teaching. Answer B. Administer oral medications to stable clients. Rationale: LPNs can administer meds, RNs handle assessments and teaching. Question 25. A client with myasthenia gravis develops increasing weakness and difficulty swallowing. What is the priority action? A. Administer anticholinesterase medication. B. Prepare for intubation. C. Encourage rest. D. Provide thickened liquids. Answer B. Prepare for intubation. Rationale: airway compromise risk leads to priority over medication.
Question 26. Select all that apply. A nurse is teaching a client taking warfarin. Which statements indicate correct understanding? A. I will avoid green leafy vegetables. B. I will have my INR checked regularly. C. I can take aspirin for headaches. D. I will report unusual bleeding. E. I will double my dose if I miss one. Answer: A, B, D. I will avoid green leafy vegetables. I will have my INR checked regularly. I will report unusual bleeding. Rationale: vitamin K affects warfarin. Monitor INR. Bleeding risk. No aspirin, no dose doubling. Question 27. A client with syndrome of inappropriate antidiuretic hormone, SIADH, is being treated. Which intervention is most appropriate? A. Encourage fluid intake. B. Administer hypotonic IV fluids. C. Restrict fluids. D. Administer potassium supplements. Answer: C. Restrict fluids. Rationale: SIADH equals fluid retention, leads to dilutional hyponatremia, leads to fluid restriction is key. Question 28. A client with a chest tube, which finding requires immediate action? A. Continuous bubbling in the water seal chamber. B. Intermittent bubbling with coughing. C. Drainage of 50 milliliters per hour. D. Tidling in the chamber. Answer: A. Continuous bubbling in the water seal chamber. Rationale: indicates air leak, leads to system malfunction. Question 29. Select all that apply. A client with hypoglycemia is unconscious. Which actions should the nurse take? A. Administer IV glucose. B. Give oral glucose tablets. C. Administer glucagon IM. D. Place client in side-lying position. E. Start insulin infusion. Answer: A, C, D. Administer IV glucose. Administer glucagon IM. Place client in side-lying position. Rationale: treat hypoglycemia safely, protect airway, no oral intake. Question 30. A client's potassium level dropped from 4.2 milliequivalents per liter to 3.0 milliequivalents per liter after diuretic therapy. Which assessment is priority? A. Bowel sounds. B. Muscle strength. C. Cardiac rhythm. D. Urine output. Answer: C. Cardiac rhythm. Rationale: hypokalemia leads to life-threatening dysrhythmias.
Question 31. A client with septic shock is receiving IV fluids but remains hypotensive. BP 78/42 millimeters of mercury.
What is the next priority intervention? A. Administer broad-spectrum antibiotics. B. Initiate vasopressor therapy. C. Increase IV fluid rate. Or D. Obtain blood cultures. Answer is B. Initiate vasopressor therapy. Rationale: persistent hypotension after fluids, vasopressors required to maintain perfusion. Question 32. Select all that apply. A nurse is assessing a client with acute respiratory distress syndrome, ARDS. Which findings are expected? A. Severe hypoxemia. B. Decreased lung compliance. C. Bilateral infiltrates on chest X-ray. D. Hyperinflated lungs. Or E. Respiratory alkalosis early. Answer is A, B, C, E. Severe hypoxemia, decreased lung compliance, bilateral infiltrates on chest X-ray, and respiratory alkalosis early. Rationale: ARDS equals stiff lungs, poor oxygenation, and early hyperventilation. Question 33. A client with a history of stroke suddenly develops slurred speech and unilateral weakness. What is the nurse's first action? A. Administer aspirin. B. Perform a rapid neurological assessment. C. Call the provider. Or D. Prepare for CT scan. Answer is B. Perform a rapid neurological assessment. Rationale: confirm stroke signs, fast. Assessment precedes intervention. Question 34. A nurse is caring for a client with a potassium level of 2.8 millieols per liter. Which ECG change should the nurse expect? A. Peaked T waves. B. U waves. C. ST elevation. Or D. Wide QRS. Answer is B. U waves. Rationale: hypokalemia equals U waves, flat T waves, arrhythmia risk. Question 35. A client with diabetic ketoacidosis, DKA, is receiving insulin therapy. Blood glucose drops from 600 milligrams per deciliter to 250 milligrams per deciliter. What is the next action? A. Stop insulin infusion. B. Add dextrose to IV fluids. C. Increase insulin rate. Or D. Administer glucagon. Answer is B. Add dextrose to IV fluids. Rationale: prevent hypoglycemia while continuing ketosis correction.
Question 36. Select all that apply. A nurse is caring for a client with a head injury. Which findings indicate increased intracranial pressure, ICP? A. Projectile vomiting. B. Bradycardia. C. Hypotension. D. Irregular respirations. E. Decreased level of consciousness. Answer: A, B, D, E. Projectile vomiting, bradycardia, irregular respirations, decreased level of consciousness. Rationale: Cushing's triad plus neurodecline equals increased ICP. Question 37. A client receiving total parenteral nutrition, TPN, suddenly develops fever and chills. What is the priority action? A. Slow the infusion. B. Stop the TPN. C. Change IV tubing. D. Notify the provider. Answer: B. Stop the TPN. Rationale: suspected infection, stop infusion immediately. Question 38. A client with a pulmonary embolism is which medication expected? A. Warfarin. B. Heparin. C. Aspirin. D. Clopidogrel. Answer: B. Heparin. Rationale: immediate anticoagulation. Heparin is first line in acute PE. Question 39.
A client with acute kidney injury has potassium of 6.8 milliequivalents per liter. Which medication should the nurse anticipate first? A. Sodium bicarbonate. B. Calcium gluconate. C. Furosemide. D. Kayexalate. Answer B. Calcium gluconate. Rationale: stabilizes cardiac membrane immediately before shifting or removing potassium. Question 40. A client post-abdominal surgery suddenly becomes restless, tachycardic, and hypotensive. What is the priority assessment? A. Pain level. B. Surgical incision site. C. Urine output. D. Bowel sounds. Answer B. Surgical incision site. Rationale: suspected hemorrhage, check source of bleeding first.
Question 41. A client with bacterial meningitis is admitted. What is the priority nursing action? A. Initiate droplet precautions. B. Administer antibiotics. C. Obtain blood cultures. D. Perform neurologic assessment. Answer A. Initiate droplet precautions. Rationale: prevent transmission immediately before all other actions. Question 42. Select all that apply. A nurse is caring for a client with hypovolemic shock. Which findings are expected? A. Tachycardia. B. Hypotension. C. Warm flushed skin. D. Decreased urine output. E. Altered mental status. Answer A, B, D, E. Tachycardia, hypotension, decreased urine output, altered mental status. Rationale: poor perfusion, classic shock signs. Skin is cool, not warm. Question 43. A client receiving chemotherapy has a neutrophil count of 500 per millimeter cubed. Which action is priority? A. Encourage visitors. B. Place in protective isolation. C. Administer live vaccines. D. Provide fresh flowers. Answer B. Place in protective isolation. Rationale: severe neutropenia equals high infection risk equals protect immediately. Question 44. A nurse is caring for a client with a nasogastric tube connected to suction. Which finding requires intervention? A. Green drainage. B. Output of 300 milliliters per day. C. Absent bowel sounds. D. Continuous suction applied. Answer D. Continuous suction applied. Rationale: NG tubes require low intermittent suction to prevent mucosal damage. Question 45. Select all that apply. A nurse is assessing a client for signs of fluid volume deficit. Which findings are expected? A. Dry mucous membranes. B. Tachycardia. C. Hypertension. D. Decreased skin turgor. E. Increased urine output. Answer A, B, D. Dry mucous membranes, tachycardia, decreased skin turgor. Rationale: dehydration signs. Urine output decreases, not increases. Question 46. A client develops sudden wheezing, hypotension, and swelling after receiving an antibiotic. What is the priority intervention? A. Administer diphenhydramine. B. Administer epinephrine. C. Apply oxygen. D. Start IV fluids. The answer is B. Administer epinephrine. Anaphylaxis, epinephrine is first-line life-saving. Question 47. A nurse is caring for a client with a femur fracture. Which complication is the priority to monitor? A. Infection. B. Fat embolism syndrome. C. delayed healing? D. Muscle atrophy. The answer is B. Fat embolism syndrome. Life-threatening complication: respiratory distress, petechiae. Question 48. A client with liver cirrhosis develops confusion and asterixis. Which medication should the nurse anticipate? A. Furosemide. B. Lactulose. C. Spironolactone. D. Propranolol. The answer is B. Lactulose. Hepatic encephalopathy reduces ammonia levels. Question 49. Select all that apply. A nurse is teaching a client with heart failure about self-management. Which statements indicate understanding? A. I will weigh myself daily. B. I will limit sodium intake. C. I will stop medication when I feel better. D. I will report sudden weight gain. E. I will drink unlimited fluids. The answer is A, B, D. I will weigh myself daily. I will limit sodium intake. I will report sudden weight gain. Rationale: core HF management. Avoid stopping meds and fluid overload. Question 50. A nurse is caring for a client who suddenly becomes unresponsive with no pulse. What is the first action? A. Call the provider. B. Begin chest compressions. C. Administer epinephrine. D. Apply oxygen. The answer is B. Begin chest compressions. Cardiac arrest, immediate CPR, CAB priority. You don't pass Nclex by memorizing, you pass by thinking like a nurse under pressure. On exam day, airway beats everything. Assess before action unless dying. Treat the cause, not the symptom. When in doubt, pick the safest patient outcome. If a question feels confusing, it's supposed to. Break it down. Find the threat, kill the threat. Subscribe for more high-level Nclex mastery.